Hello to all. I am Dr. Puja Suri, a homeopathic physician and practicing homeopathy for 13 years. In this video, we will talk about a very common ailment, melasma, with a presentation of a cured case of melasma. So first we shall discuss what is melasma. Melasma is circumscribed hypermelanosis of the face and occasionally the forearms. Melasma is commonly known as hyperpigmentation of skin, where we can see light brown to dark brown and grey blotchy skin. The pathogenesis of melasma is little complex, so the treatment remains challenging. Melasma is much more common in dark skinned people. Melasma is more prevalent in women during their reproductive years, peak age between 20 to 30 years. Pathophysiology of melasma. Pathophysiology of melasma remains multifactorial but unclear too. Number 1, we will discuss about the sun exposure. Sun exposure, that is ultraviolet radiation exposure, is the classical influencing factor that causes elevated levels of nitric oxide synthase within keratinocytes that shows to have a role in the process of melanogenesis. This increase in nitric oxide can be seen through activation of NF-κB pathway under ultraviolet radiation. Now, as we talk about tyrosinase, a vital enzyme that helps in the production of melanin by oxidizing an amino acid called tyrosine. Tyrosinase is found in melanocytes. So, increase in tyrosinase can lead to hypermelanosis. Melanin, a skin pigment that protects your skin from harmful ultraviolet radiations and give your skin, hair, eyes their natural color. So why excess of tyrosinase is detrimental? This is because this overproduction can lead to unwanted tan, pigmented patches, and dark spots. Now, the second thing we will discuss here is hormonal therapies. Under the pathophysiology, the hormonal therapies contribute to the development of melasma. Melasma is commonly reported in women using hormone replacement therapy for prevention of osteoporosis, estrogen progesterone oral contraceptives. The mechanism in production of melasma by estrogen may be due to the presence of estrogen receptors or on melanocytes that stimulate the cells to produce more melanin. The third is characteristic feature of melasma is symmetry of hyperpigmentation and distribution of lesion is related to trigeminal nerves, which is suggestive of neural involvement in pathogenesis of melasma. In some studies, higher level of neural endopeptidase was found in melasma lesions and suggest that neuroactive molecules are some critical factors for the pathogenesis of melasma. Now, the genetics also play some role. Genetics do play an important role in causation of melasma. We have other potential causes too. As we mentioned above, the exact causes are yet not fully understood. In addition to above discussed causes, there are a few more causes such as stress. While psychological stress is not in itself a skin irritant, but it is considered to be a possible melasma trigger. Stress causes our body to increase the hormone cortisol, which in turn influences the amount of estrogen in the body, which can therefore cause hyperpigmentation. Next being the thyroid problems, where the thyroxine that is released by thyroid gland plays a crucial role in functioning of various cells in your body, including skin. In men also, we can see some melasma lesions. This is because who use estrogen therapy for prostate cancer may develop melasma lesions. Now let's discuss about the clinical presentation of melasma. Clinically, melasma presents as a symmetrically distributed macular pigmentation. It has irregular borders and color may vary from light to dark brown or brown gray. Melasma lesions may be located on cheeks, forehead, nose, upper lip, chin, and forearms. Pigmentation appears slowly over weeks or years, and the patches getting worse in summers. According to lesion distribution, clinically, we can see three patterns of melasma. Number one being centrofacial pattern that involves forehead, upper lip, cheeks, nose, and chin. The second pattern is malar pattern that involves cheeks and nose. And the third pattern is mandibular pattern involves the ramus of the mandible. Now the depth of the melanin in skin is measured by Wood's lamp, the investigation tool. It may also serve as prognostic guide in the treatment. According to Wood's light examination, melasma is classified as follows. Number 1, epidermal melasma, that is light brown under Wood's light. The second is dermal melasma, that is brown or bluish gray by visible light under Wood's light, and it has less distinct borders with no enhancement of pigmentation. And the third is mixed melasma, in which there is dark brown enhancement of pigmentation is also present. Now let's come up to the homeopathic approach to melasma. Homeopathy is the most popular holistic approach to disease. Remedy selection is completely based on the symptom similarity and theory of individualization. The aim of homeopathy is to address the underlying cause and susceptibility of a person to acquire the disease. Some homeopathic remedies that turn to be very helpful for melasma are Pulsatilla nigricans, Sepia officinalis, Thuja occidentalis, cadmium sulf, Colophyllum, Conium mac, Ferrum met, Lycopodium, Nitric acidum, Nux vomica, Pollinia pinnata. Now let's discuss the cured case of melasma. A female 39 years visited the OPD on 20th February 2018, presented with a complaint of hyperpigmentation on cheeks since 4 years. She had earthy dull complexion, and the medicinal history was she applied some skin lightening creams. Now, as we come to family history, father had a history of hypertension and coronary artery disease. Mother had no history of chronic illness. Now, the patient's menstrual history was as follows. She had a history of scanty menses, though the cycles were regular, sharp pains in lower abdomen during menses, pressure in pelvic area, no history of leukorrhea. Now, the patient's mental symptoms. She was anxious about her present condition of the face. She cries whenever she is sad or upset or tensed about anything. She had unstable mood before menses. We can call it as hormonal causes for mood swings. Now we come over to GIT. She had normal stool with abdominal bloating sometimes. Appetite was normal with no thirst. Sleep was normal. Dreams she never remembered. Thermals was she was a chilly patient. Now here I'm going to show you before and after treatment pictures. We can clearly see the difference in the melasma patch after the treatment. It was all gone in the time duration of 4 months. Next, I am presenting with the repertorial chart, the rubrics taken and the remedy selected. The first rubric selected was anxiety, health about. Second rubric added was weeping, tearful mood, trifles about. Next was discoloration cheeks, and then was pain, bearing down menses during, and the last rubric I had mildness. So after repertorization of the case, following medicines had the most symptom similarity. Those medicines were ignatia, pulsatilla, sepia, natramur, sulfur, veratrum belladonna, and the medicine selected was sepia officinalis. So the patient was given sepia officinalis, and in the time duration of just 4 months, we achieved 90% results. Now let's have a quick look on the follow-up chart of the patient. The first follow-up that we had was on 18th of March 2018. The first follow-up was after 1 month, in which the lesions appeared to be little light, not much change was seen. The same remedy was repeated with same potency. The next follow-up that we had was on 24th of April 2018. This was the second follow-up almost after a month again. In this second follow-up, we could see the major change of around 60% of lightening of the lesions. No remedy was given, only placebo was continued. The third follow-up that we had was on 29th of May 2018. There was 70 to 80% improvement in dark patches. No remedy was given in the third follow-up. And the last visit of the patient was on 26th of June 2018, where we could see the remarkable results with 90% cure. So this case was totally individualized case with most symptom similarity based remedy. Remedy given was none other than homeopathy, with no local applications or any skin lightening creams. We have many such proved cases in homeopathy. So this was all about melasma and action of homeopathic remedies. Thank you so much for watching this video. Keep connected.